Hello, everyone. Welcome to the webinar. It is 12 and we are ready to start. My name is Hiltrud Dawson. I'm one of the health promotion consultants and lead at Best Start by Health Nexus. Just checking, can you hear me?
I can hear you, Hiltrud.
Good. Okay, that's great. Okay, so let's hope everyone else can hear me. I don't hear anything different. So we are really excited about this webinar. We have been working for quite some time on our new resources platform, and we're very excited to show it off today. Before we do that, just a couple of housekeeping notes. Please type in the chat box if you have any questions. Type whenever, and we will look at them at the end. And discuss them. We will have quite a bit of time for questions, I think. Um, we will send out or send you a link to the evaluation at the end. It should open right up, so please evaluate the webinar. We are recording the webinar, so if your colleagues missed it, we will be sending out a link to the recording to the listserv so that anyone else can join at a later point and watch the webinar. We do have the chat, I already mentioned that, so you can talk in there or you can type in there and we will keep an eye on that. I may do some of the answering while we're on the line, or we will do the questions, answer the questions at the end. Before I hand it over to our presenter, I just want to also thank our technical expert team, Sam, who's our tech support, and Marie and Malou, who are on the line to do any troubleshooting. And I had a bit of trouble with the sound, so it was just awesome having them there and getting everything organized. And they just do a lot of work behind the scenes, and we're always very happy to know they're there. And I want to just start with a traditional land acknowledgement. The Health Nexus office in Toronto is based on the historical territory of the Wendat, Petun, Seneca, and most recently the Mississaugas of the New Credit First Nations. This territory is covered by the Dishwis-Witherspoon Wampoon Belt Covenant, an agreement between the Haudenosaunee and the Ojibwe and allied nations to peaceably share and care for the lands and resources around the Great Lakes. Today, Toronto is the home of many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work within this territory. And now I want to hand it over to Magali, who is our bit of everything extraordinaire. She is our information specialist, so that means she pulls research, she looks for information, she connects you to a number of different things. She administers the listservs. She was our conference organizer, so she has just got a hand in everything. And most recently, she's been the lead for doing, or in the last over the last 9 months or more, she's been the lead to get this up and running. Sorry about that. I'll hand it right over to Megan.
Hello, everyone. Thanks for the nice introduction, Hiltrud. I hope Hiltrud didn't raise your expectations too much. In the spirit of full disclosure, I would like to mention that this is my first webinar. So please let me know in the chat box if I'm speaking too fast or too slow or not loud enough, or if you get bored, and I will try my best to accommodate. Before we get started, I was hoping to give you a quick overview of what it is that Best Start does and how we can support your work. I'm sure most of you are aware of some of the things we do, but maybe there's a few things that you don't quite know yet. This on the left is a screenshot of the homepage of our website. It's beststart.org. It kind of really summarizes who we are and what we do. For example, in the logo there and the little French button up there tells you that we are a bilingual organization. The blue-green box here tells you that Best Start works for service providers in the areas of health before, during, and after pregnancy, and the early childhood development and education. You can also see on the logo that Best Start is a key program of Health Nexus, and I can't spend too much time describing Health Nexus. But if you work in partnership, or if you would like to develop, partnerships, work with other organizations, work more effectively, have more efficient meetings, be more inclusive, being more equitable, develop leadership, I strongly recommend that you visit the Health Nexus website or that you contact us, because that's what we do and we can definitely help. Now, regarding Best Start services, we can gather them in three big groups. The first one is trainings. We've got trainings in person, like workshops. We had 5 workshops over the summer on stress and parenting. We have the conference that was early February. We have also online training, such as online courses that are free, and all those webinars that we offer. And on the website, you can find them. The upcoming events are here in the news and events section. But I strongly recommend that you also look at the services category, the services pages on the website, where you will find all our past webinars that are recorded and that you can access, our online courses, and many, many other things. The second category of services that we provide are related to information. We keep you updated on what's going on in the province of Ontario, mostly in your field, through the bulletins. And you can ask questions and promote your own stuff and generally network and exchange information on our listservs down here. And you can sign up for those listservs, and everything you need to know will end up in your inbox. And finally, the reason we're here today, the third category of services we offer are resources. And the resources are all meant to help you in your work. Some of them are for your own knowledge, and some of them are meant to be handed out to parents. And I'll be talking a lot about resources today, but I just want to point out that we're very proud that many of our resources exist in multiple languages, and many of them have adaptations for the Indigenous families of Ontario. And I forgot to advance my slides, so I had a nice little animation that we missed. There you go. That's to focus more on what we're going to talk about today. We're going to talk about our new online resource platform. And through that webinar, I'm hoping to answer the following questions. Why do we need a new resource platform? Who it is intended for? What it looks like? What has changed? What is new? And the various ways you can access our many resources. So why a new platform? Let me talk to you a little bit about our resources. Our resources are really good. And I'm not saying that just because I think so, but because we have evaluations, we ask our customers, we keep track of what's happening with those resources, and everything tends to tell us that those resources really work. This list that you see here has been developed according to Best Start's standards, but also according to the feedback of our customers. Our resources are evidence-informed. They're consistent across Ontario. They are very well known and well used. For example, in the past, I think those were 2017 and 18, we sold 225,000 resources that year. And those are just the purchase of printed resources. Doesn't include the downloads, doesn't include the resources we handed out in events. So that's a fair amount. Those resources make a change in practice for you, and we'll show you that on the next slide. They will save you time and money. You don't have to create a resource for everything. We have a lot of resources that you're free to use, free to adapt. I mentioned the indigenous adaptations and resources for newcomers, and they're very low cost. Most of our resources are free on the website, and we used to sell printed versions of some of them at very, very low cost. Um, this big round thing here is a word cloud that we did. Um, we asked our customers what they found our resources useful for, and you can see that they help them in their interaction with their clients, with their customers, with the families, with the future families. Um, so there. So this is a quick slide based on the evaluation of our services that show you that our resources, according to our customers, help integrate best practices, help save time and resources, increase their efficiency, the effectiveness of their work, help service providers achieve their goals, and improve specific aspects of their practice. And you can see that we get really good scores on all those categories. The thing is, though, that maintaining printed and online resources is a lot of work, especially the printed resources. For example, what you see here on those pictures is about 1/5 of our warehouse. At times, we would store about 500,000 worth of resources in there. I will let you imagine, the storage costs, the insurance costs, all those types of things. You also see here some of our employees doing the biannual manual inventory count that our auditors would request. So a couple of times a year, 4 of us would go for about 4 days to count all the resources, make sure that they're insured and everything is fine. Maintaining such a huge stock of resources is a lot of administrative and accounting work. We keep our resources up to date. And imagine when you have printed resources and you need to update them, what happens to the old stock? We discard it. We've been discarding lots and lots of paper. And that's not environment friendly at all. And we would sell the resources, but we didn't want to sell them too expensive, make them too expensive. And so the printing costs and all those other costs I've listed here were not offset by the sale of resources. And we were very, very dependent on our funding to maintain the printed resources. For a couple of years, really, we would regularly at staff meetings discuss, increasing the price of resources, trying to find a way to be more environmentally friendly and more cost efficient. And finally, the decision was kind of taken off our hands in early 2018 for various reasons. It was decided that Best Start was no longer able to sustain the sale of printed resources. And therefore, we would move on to digital only. That was the only way we could keep providing services, and we would keep maintaining the whole range of resources. This decision had a couple of advantages, such as decrease our carbon footprint, such as, like I said, maintain and keep producing the large set of high quality, up-to-date resources. It also gave us the freedom to explore new ways of sharing information beyond handing out a pamphlet, like what else can we do to have families access good evidence-based information. And mostly it allowed us to survive despite severe budget cuts. Now, I would like to point out at this point that this was not a popular decision within the team. It was a very tough decision to make. It quite frankly broke our hearts. And the way we coped with that decision is to commit to help our customers transition to digital-only resources. We committed to look into new ways of bringing resources to families and to service providers. And the first step was to make our website more accessible, more welcoming, easier to search for you guys. And this is how the new resource platform started. Now, who should use this platform? We've got two big categories of resources. We have resources that are for service providers, for you guys, for your colleagues, such as manuals, reports, ready-to-use workshops, websites, online courses, those types of things. And then we have resources for you guys to hand out to families. Uh, Again, websites, videos, pamphlets, books, booklets, um, you name it. So all those resources are available in the resources category here, and I will go into detail later. And then the resources that are meant for parents are also available on a different web page that you can access here. And again, I will get back to that later. Actually, I will get back not too much later because I think it is time to actually go and visit the new platform. So this is the link of the platform, resources.beststart.org. And if you want to refer parents to their own web pages, you just add /parents at the end of that link. Now, bear with me for a few minutes because I need to switch to the website. It's just going to take a few seconds. Perfect. All right, so this, you should be familiar with that page now because I showed it earlier. It's the main page of the Best Start website. And like I said, if you want to go to service provider resources, you would click on that button here, it says resources. And if you want to go to the For Parents website, then you would click here like I'm doing now. Ta-da, lo and behold, here's the new platform.
Is it low?
The, is
Low?
it too low? Okay, hold on. Is that better?
It's good.
Perfect. Right. So what you can see right away, I think, if you look at the top right corner here, is that the platform is fully bilingual. You can choose to go and have everything in French. Just a minute. There you go. And you can go to have everything in English, like we're going to do today. Another thing you can notice is that visitors have the different ways to look for a resource. They can look for a specific resource in the search box here. For example, they can type cannabis, and they will be taken to a page which lists all the various things we have about cannabis on that website. Or they can just go to the main page and scroll down, and they will have various categories that they can pick based on their situation and their interests. If they pick a category, for example, they just had a baby, they want to see how to care for a baby, they're going to click over here, and they're taken to a list of all the resources we have in that category. There are 10 resources per page, and there are several pages, as you can see here. If they scroll down a little bit more, visitors will get a list of resources and websites by other organizations that they are welcome to browse, and we check those regularly. The resources by default on that page are organized by the last revised. So the most recently revised resources on that page are the cannabis booklets that you can see here, but you can choose to sort them by title or by the resource code. Those of you who used to buy printed resources may be familiar with those library codes. You will note that on the English website, even if the resource is in French, like that second booklet here, the description is going to be in English because you chose to get the service in English. If you were on the French side, that resource in English here would have a description in French. Just checking that I'm on track now. For service providers, the website looks very similar, is organized pretty much the same way. as you can see here, you can still search for specific resources by code or by keyword like I did before. You can also pick a category of resources. And if you scroll down a little bit more, you've got two things that I would like to point out. The first one is our bilingual flyer for parents. So you can, print that flyer and hand it out to parents, and it will refer them to the For Parents website that we just visited. Or you can just give them the link, of course. And then that second thing here is information about adaptations. An adaptation is the process of making small to major changes to our resources, or quoting part of our resources, or hosting one of our resources on your website. Say you live in Nova Scotia and you want one of our booklets on breastfeeding, but the contact information in the booklet is going to be about Ontario organizations. You want to make it a Nova Scotia organization booklet. Then you would go through that process, and we would allow you to do that, to modify that resource. Don't hesitate to contact us to learn more. So say you're, an early childhood educator or a home daycare worker, and you're interested in child development. You are then taken to, again, a list of resources in that category, organized by last revised date, 10 resources per page, but many pages. And at the bottom, you have all types of extra links and websites and things that may interest you if you're working in that field. If I choose one of those resources, for example, the Baby One booklet over here, I click on Read More or on the picture, and I'm taken to the resource page that you can see here. Here you have the title, the picture, and the short description that you had on the former page. But if you scroll down, you get a longer description. And I strongly recommend that you always have a look at the long description, because it contains information about the various formats the resource may be available in, or possibly about other related resources. We have a booklet on breastfeeding that comes with fact sheets. You will find those fact sheets in that long description here. All the links to the resource in many other languages is going to be down there too, as you can see here. That resource is available in several languages beyond English and French. So I really recommend that you always have a look at the long description. On the right-hand side over here, you have the various free formats of that resource. This resource is available for free as a PDF, a low-resolution PDF, that you can download and print on an office printer, or just refer parents to. And I mean, you guys know what a PDF looks like, right? Just like this. And the reason I picked this particular resource to show you today is because it is also available in a new format for us, which is like a web page. We call it HTML, and that's what it looks like. This format is very printer friendly because it's mostly text with very few pictures, so you're not wasting a lot of ink. It is also mobile friendly, so if I were to look at it on a cell phone, it would still be perfectly readable. And Best Start is committed to progressively converting our resources, for parents especially, into that format, because it's very convenient. Like, you go see someone, you have your cell phone on you, you can show them a resource. If we go back on the resource page, between the short description and the long description, over here you have the resource code name. For those of you who used to buy printed resources and are familiar with those codes, that's where it is. You can check it's the right resource. And the various categories this resource is going to appear in on our website. And then there's that price here that you can see, and I'm going to talk about this a little bit. For resources that used to be available in printed form, you have the option to purchase ready-to-print files. This is intended for visitors who want to print fairly large quantities of the resource by professional printers. Professional printers will not be happy with the free low-resolution PDF here. They will need a PDF that has high-resolution pictures that have crop marks around and bleeds and all types of things. And BestArt can provide you with those files, and then it's up to you to get the printing done. And I'm going to talk now a little bit about how to purchase those files. Obviously, the first thing you do is add that file to your cart. So say I want to buy the Baby Wants in English and in French files. So I'm going to click here, Add to Cart. And then I'm going to go and look at, find the French one. So maybe I can go here. Here and click Add to Cart. And when I'm done adding all my resources, I can either click View Cart here, or I can go into this category of this list of pages here in your account, and I'm going to go to Cart. This part of the website, those web pages, are for you if you're buying those files. If you're not buying those files, you don't need to care about the Your Account part. You won't really need it. So I go to Cart. So you see the files that I selected. I strongly recommend that you read these instructions before proceeding further. It gives you all types of information about the methods of payments and where to go to download your files and all types of things. And when I'm ready to buy, I'm going to click Proceed to Checkout. The first time you buy a resource from us, you will need to create an account, even if you used to buy resources from us before. This is a new software, so you need to re-register again. Make sure to remember your username and password so that you don't have to re-register every single time, because I'm sure you will buy lots of files from us. Because I already have an account, my information is already pre-filled. And you will notice over here that we accept two types of payments, checks, and I apologize for the wrong spelling here. We looked into it. We haven't been able to change it, so we asked the software people to change it for us. It's in progress. In the meantime, we have to deal with the bad spelling. Anyways, so you can pay by check, and you can pay by credit card. And I would recommend, if you have the option, to pay by credit card, because then you can download your files right away. The files you buy are downloadable only once we have received your payment. In this case, because I don't really want to purchase those files because I can get them for free because I work at BestArt, but we're going to pretend. So I'm going to choose the pay by check option and click place order. At this point, in a minute or so, you can't see, but I will receive a confirmation email that I encourage you to keep for your records. And then I will prepare my check, send it out to BestArt or to Health Nexus, and Health Nexus will cache it and tell that tell the new platform that the payment has been received. When that happens, you will get a notification email, and you can go into your account details, and downloads. That's where the files that you have paid for will appear. And here you can see that both files that I wanted to buy are available here. This here clicking here takes you to the resource page. Clicking on the big green button makes you download the files. It is very important for you to know that once you buy the files, you can download them up to 5 times. I already downloaded it once to make sure it was working. Up to 5 times for a month from the moment we receive the payment. After that, you will need to buy, to buy the files again. So make sure you download the files and save them, and remember where you save them and everything, because after a month you will need to buy the files again. Now, this is the end of my overview of the new platform. I think while we're still on the website, we should take a moment to answer any questions you guys may have before we go back to the presentation. If you have any questions, please type them in the chat box around now. Matushka is asking, what is the advantage of buying high-resolution files? There's an advantage if you want to buy large quantities, to have large quantities of printed resources. If you just want to refer your clients to a resource, or if you just want to print a couple on your office printer, the regular free PDFs are perfectly fine. So if you want to print large quantities of resources by a professional printer, that's when you need the high resolution files, because they are better quality. The pictures are going to be more are going to look better. They're going to have a higher resolution. There's going to be crop marks. There's going to be all kinds of things that professional printers will need. Carl is asking, if we buy a high resolution file and the resource gets updated, will we be notified of the update, or will we have to take note of updates ourselves? Kind of both, Carl. If you are registered to our listservs, when we update a resource, very often we post a little notification on the listserv. Remember when I was talking about all the services Besta provides about information? So if you subscribe to the listserv, you will be notified. Otherwise, I would recommend that you check the updates ourselves. For any given resource, the date of last revision is usually written on the last page. Hamilton is asking, if once we buy the high resolution files for print, would we have to repurchase it if or where there are updates? If they are updated more than a month after we receive the payment, yes, you would need to purchase it again. But it's, only $50. I mean, I don't know what your budget is, but creating a new resource from start or updating a resource is more than $50. Does that answer your questions, you guys? Do you have any more questions? I can keep an eye on the chat box if you have more questions, and I will make sure to answer them. So give me a few seconds for me to go back to the presentation, and I just have a few more slides. All right, so I think we've covered that. Now, so just we're reaching the end of the webinar, unless you have more questions. And I hope that during this webinar, I convinced you that we still offer the same choice of top quality resources, that they are still available for free in at least one format, sometimes more, but that they are now gathered in a platform that is fully bilingual, that is searchable, that is that is more accessible, more user-friendly. And I hope that I also conveyed the message that we are committed to make more of our resources available as web pages or in more mobile-friendly, printer-friendly, accessible formats in the future. It is our hope that you will share these resources widely with your colleagues and with your clients, either online or in printed forms if you have to, either on your own devices, like that service provider over here, or refer parents to it and they can browse it in their own time. Or, if you have to, print a couple of resources or maybe, and bring them over. By the way, if any of you wonder what Hiltrud Dawson looks like, she's the one holding the phone over here. If you have any questions, any comments, any suggestions, any ideas, any problems, never hesitate to contact us. Drop us an email. The resource platform is awesome. I think Magali should get a big raise, or I can't find that particular resource. Do you still carry it? Or, other things. Write to us, call us. We want to hear from you. We want to help you. We are reaching the end of the webinar. I'm just going to check the um, chat box. Let me see. I just want to be clear, we cannot download any other copies after 1 month. Yes, that is correct. The reason is we are trying to protect our files a little bit, so you can download it and then, some of your colleagues can download it a little bit, but after a while, no one would buy the resources, right? Like you would have it and you could just spread it around, and we need to keep an eye and protect our files. Is there a way of knowing if a resource is under revision before we purchase the file? Yes, you can call us or email us and we'll let you know. Because you don't want to go ahead and print lots of files, lots of copies, and then a month later the resource is not up to date anymore. So absolutely, drop us an email, give us a call, and we'll let you know. And this, I think I answered all your questions, you guys. This is the end of the webinar. The recording of this webinar, if everything goes well, will be posted on our website very shortly. Don't hesitate to share the link with other service providers and spread the word. Once I close that room here that you see, you will be directed to our evaluation. I would like to stress out that it is very important that you fill this survey, really. First, we need to know what you thought about the webinar, especially since it's my first webinar, but also because we want to do a better job in the future, and also because we provide that data to our funders, and that's part of how we get funding. So it's very important. I hope you enjoyed that webinar. I'm checking the questions one last time, and then I will let you go. Can the patient access themselves? Yes, the patients can access themselves. I'm going to show you the link. If you refer parents to that second link over here, resource.bestart.org/for-parents, this is only the resources that are meant to be read by parents. So I strongly recommend that you provide your customers with that link, or that you download our one-pager that is available at that link above. All right. I'm going to stop the webinar now. I hope that we'll be in touch very soon, and take care.